So, good afternoon to everybody. It's a great pleasure to be here. My name is Dr. Santos. I come from Brazil, and I'm going to talk to you about PDO threads for the body. As you know, Brazilian people, Brazilian girls, they really care about body shaping. They really care about being beautiful. And we as physicians, they ask us to do the most so they can have the beauty with them, they can feel confidence, they can have good self-esteem, they can keep the body shape, they want to have a nice contouring, and they want a non-invasive treatment. Non-invasive treatment is a very important keyword because everybody wants the beauty, but people doesn't want it to be off. Like surgery, you need to be off some days, you have like sometimes ecchymosis, hematomas, you have sutures, you have scars, and people really want to know invasive techniques. I'm going to present to you a very interesting presentation about body contouring solution using PDO threads. I believe that most of you know PDO threads, and I believe that most of you use PDO threads. But so far, PDO threads are more popular for face than for the body. So we are going to present for you very interesting solution using the PDO threads. PDO threads we are going to use comes from a company named Samyang. It's a big, very big Korean company. It's a pharmaceutical company. And it was founded in 1924. Has over 3,000 employees. It's really large. And then along the years, they were improving and augmenting their work and presentation. And on the year 2020, they started launching the Croquis PDO thread. With the PDO thread I'm going to present to you. I started using PDO in the year 2014. So I have almost 10 years of experience with PDO. And in Brazil, we have a very heavy practice. We have a very heavy practice in office, and we have a very heavy practice in training courses. So if I'm not doing my office, I'm doing a training course. So it's very important because we build a very strong experience. So the market potential for PDO thread is huge. It's much bigger than you think it is, and you can use much PDO thread than you are used to. I'm going to show you some opportunities and some indications different. The Croquis PDO thread line has mono thread, which are the smooth thread, has the screw thread, volume thread, barbary cutting, and barbary molding. And there are new models and new types that are going to sort in a little while. Please take it off. Oh my God, sorry. Put it down, please, Mr. Cooley. So these threads, they have some special features I'd like to introduce to you. One of the very important features about Croquis PDO thread is that the guarantee is really, the quality is really guaranteed, as the threads, they have been passed for some type of tests, and the tests show that the PDO threads from Croquis, they last long, and they have less possibility to degrade. So it's more intense, the result. They did studies exposing the products in 90 degrees for 15 days. And after they study, the PDO thread from Croquis remained in 75% strength, and the others, they were powder or they disappeared. So it's very important. I have used other PDO threads before, and it's really different, the one from Croquis brand. Regarding to the expiration time, the other brands that I know have 1 year, and Croquis in Brazil has 2 years, but Croquis in Korea has 3 years of validation. So if you have 3 years or 2 years of validation, it means that the product is more built, it's more stronger, and it's better. As I said to you, there is less degradation. And when you want to use the threads for suspension, the thread that has the barbs, PDO threads from Croquis has also different, the USP, I'm sorry. There is a word in here, but it's not appealing. The USP of the thread of the competitors are smaller than the PDO from croquis. So it means it can lift more when you want to treat a sagging face or sagging neck. So about PDO definition, we all know PDO are synthetic fiber absorbed, and they are monofilament fiber. And they're made of a lot of polymers of paradoxanone. After heat and catalysis, they become polydioxanone. It's a very interesting material because it causes almost no inflammation. It's very interesting. It works silently. It doesn't make big inflammation, doesn't make redness, and then you can have beautiful results and beautiful collagen stimulation. This is a very, very, very important information in this slide here. When we inject the PDO into the tissue, we make a mechanical stress to the fibroblast. And the fibroblast, once it's touched by so many needles, it changes itself. It's a self-changing. And all the initial and natural original structure from the fibroblasts that were in the cortex of the cell, they start to get inside the cell, and then it senses itself. It's a self-sense, and it starts to change the tissue and becomes a very differentiated myofibroblast. That's why when we see the clinical cases, the skin becomes so beautiful, and the skin becomes so much like natural and more like compact because of the quality of these fibroblasts. There is one thing that is very important for you to learn, and I really insist this in my course and in my practice, is that the number of threads matter. It really matters. If you want to do change, you cannot use 2 threads each side. You need to use lots of threads. You're going to see here that we use hundreds of threads if you want to do the results. If you want to build collagen, strong collagen, and if you want it to last, you need to use threads. We can have some scientific studies like this one that shows as the number of threads increased, the formation of collagen type 1 was also found to increase. So if you want a good result, you have to use more threads. So for body, we use PDO threads, mono and screw. We don't use PDO thread like barbed for body. We like to make a net of threads. And this net can compact fat. This net can make reshape, as you can see. We left the barbed molding type, barbed cutting type. We use this for suspension for the face, but not for the body. So the monotype that we use, they come in big boxes, and the box has 6 pouches, and each pouch has 10 units of threads. They have a different size. I'm going to show you in the presentation the size that we like to use mostly. And it's very unique, the presentation, because you have 10 threads in its pouch. So you're like not obliged, but you should use like open the pouch and use the pouch itself, not leaving the open pouch left behind. So we use the monotype a lot. And the monotype we use for the subdermal region. We use sometimes for fat, but for fat we like more the screw type. And we use for the muscle. We apply PDO on the muscle as well. And we have beautiful muscle contraction and beautiful muscle shaping. The class today is for body, so we're going to show the PDO affecting the muscle of the body. But when we do face, we can also help like wrinkles and like furrows if we use on the proper muscle of the face. So it's very important to know that PDO is not, the monothread is not to be used only for the dermal level. So screw type is also a monotype, but it has like undulated on the surface, and it can create some volume. And it's a little bit more powerful than the monothread. And for this case, we use when we want a contraction of the subcutaneous tissue. They also come in big boxes, and each box has 60 units. And the units are divided the same way in pouch, and each pouch has 10 threads. So the body application with PDO can be any area. You can apply any area, and you can have beautiful results. You can even apply, there was one doctor who was talking to me before the entrance here, and there are technique for the breast, very beautiful technique for the breast, which is not in the content of this presentation. I hope we can present for you some days. But there are special technique for the breast. but it can be used for the body, for the belly, for the thighs, and etc. It can make really a revolution. So I do a lot of buttock augmentation. This is buttock augmentation I do using filler for the buttock, okay? If the girl has this type of body, if the girl has this type of shape, it's very good that you do the filler and then everything is good. It's already done. But many people, they don't need only to augment the buttock, but they need to improve the shape. There are many people that has flaccidity. This area that we call the banana area can be this way, or this way. And this makes the looking of the body really sad. And even though that I've been doing for about 20 years the fillers for the body like this, when I had patients like this, I had no solution before. So even that I could have improvement in the upper part, it was really ugly, and the patient was really complaining about this. After learning how to use the threads, and after learning how to apply the threads in multiple layers and in multiple levels, we could get to the efficiency to make, you're going to see the results, the improvements in this area, use the fillers, but also these areas of wrinkles disappears. So the first area we are going to talk is the banana fold area. This area is an area between the lower gluteal muscle and the high thigh area. This area, if you want to see more details in anatomy, is the dark blue arrow here, is the area of the banana fold. Remember that there is what we call banana fold, which is what I just showed to you in the previous picture, which are the skin sagging, and there is the banana roll, which is something like when you have fat accumulation. Those things are different. We are talking here about the banana fold, which is this area of the skin that sags. And you cannot make beautiful buttock, even if you make the augmentation, if this area is still ugly. So in this area, we have to consider muscle, subcutaneous and dermis, and also facial tissue. And all of these tissue have to be treated, not only the skin. If you want to improve shape, if you want the thing to be like more like strong, rigid, you need to go to muscle, you need to go to fascia, and you need to go to the skin. It needs to be a combination of plates, it needs to be a combination of threads. And you cannot do this changing, you cannot do this improvement using 10 threads. It's impossible. I'm going to show you during the presentation, you have to use lots of threads, and then the result becomes fantastic. So the idea was like, what can we do here, like to push this thing inside, to make the fold disappear? What we could do here was like the idea when we started using the threads. So we selected the mono threads, and we selected the screw threads. And then we make a design. I have a video. I'm going to show to you in the video. But the design has to be from the lower part of the buttock, then the area of the banana, and then a little bit lower of the banana. All these areas have to be treated using the threads, and the threads have to be applied in multiple layers. You have to think like in your mind, this. Threads, 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 and threads, 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 threads. Threads here will address the muscle. They're going to be obliquous application, and many threads in the muscle makes the muscle pop up. And then threads here are going to address this, the gluteal sulcus and the banana area as well. I'm going to show to you a video, and I'm going to be commenting during the video. So we have so many years working, and we have so far no complication at all. We are very concerned about cleaning the skin. So every patient needs to have like an alcohol shower before anything. And we really care about asepsis and how to work. So I'm just pinching and looking at the sagging area that you have over there. And then it's been in red. We draw what is anatomical. So we drew the line of the infragluteus fold the banana area, and then we are gonna make like, we make also where you have the furrow, the depressions, you can also use like different color. So if you wanna do, because you can add some filler or some biostimulator if you want during the procedure, so makes the result even better. So use different colors, because with the different colors, it's like a map for your mind. So you know, like the red is the anatomical, the green is like the furrow, and then there is this area right in the middle of both gluteus. My professor, maybe someone of you have met Dr. Pierre Fournier. He just passed away last month. Someone here has met Dr. Pierre Fournier. He was the one who created liposuction. He was my professor. And he used to say that this area here was the Bermuda Triangles, that we must not come inside this area. We have to stop from here. It's important to limit this area. So we kind of limit the buttock where we want to do the projection, and we limit also the banana area where we're going to have also threads to do the implantation. So we measure about 10 centimeters from this Bermuda Triangle outside, which is the area where you want to do projection. And then here is the area where you want to work the levels that I told to you, all the levels together to make improvements. You have to address the area of the higher buttock where you want a projection with many threads. And the threads in this area we are going to insert, they are going to be obliquous thread. They are going to address the muscle. They touch the muscle, okay? If you want to do only skin treatment, you don't go obliquous. You go very parallel to the skin, so you stay in the dermis. But if you go obliquous, you address the muscle. So we make several layers, and then we're going to make like crossing. And then in each point, we're going to do threads. We are crossing now. And we are going to be using threads all the way here, all the way here, and all the way here. And it's going to be all filled of threads. So in blue, we are applying different points for threads. And those threads, they're having layers for skin, layers for fat, and layers for fascia. So we're going to do different layers. And in every, then make it clean, we use iodine. I don't know what you like to use, but we use iodine. We like to use iodine, and we're very careful, as I told you. We have never had infection. It's very important to take care of this. And then we make little points. It's going to be next step now. We make little points of a local anesthetic solution, because there are too many needles to be inserted, so it can be painful. If it's one needle, two needles, it's fine. But we use hundreds. So this is a solution of a very diluted anesthetic. We use 2% lidocaine with adrenaline, with epinephrine, and then we dilute it in a big amount of saline. Like we make dilution like from 1 to 10. So it's very diluted. You can inject it a lot, and it's enough so patient doesn't feel the pain, okay? So we use a very tiny needle, 32G needle in each point. When patients are very sensitive, they have numbing cream before, but if patients just like normal, they can have this little needle of 32G or 34G sometimes, and then we make all the points before doing the injections of the threads. Sorry. By the time you finish, as we have like hundreds of threads to pass, by the time you finish, when you start, you use the first point that you did, so it has already a good anesthesia, and the patient really doesn't complain. Of course, it's enough procedure. You don't need any type of other anesthesia, you don't need sedation. It's just like local anesthesia. then those threads are applied in the area where I showed you the picture, that is the fascia. And it's unbelievable. You're going to see it shapes the buttock after that. And the upper threads are applied in the gluteal muscles. So there is the combination. We are using monothread 30G, the diameter, and 40 millimeters the length. So it's enough to hit the muscle, and it's enough to hit the fascia, and it's enough to hit the subcutaneous, the subdermal area. So we apply all those threads patiently, one by one. Wait. I'm sorry, I touched it here. So we keep applying. Now we're applying the inferior area. It's very important to have an assistant to help you making the thread to release the cap, because it's very tight. So if you're gonna do it, it takes a lot of time. So the assistant just pre-open the threads for you. So when we did the blue dot, is the place where we're gonna place the 30 by 40 millimeters thread, and the red means where we did the markings. So we just said about the asepsy, and then I'm gonna show you the end of the treatment. Just a little while here. So we are going to the end here, finishing one side. And during the procedure, you can see, even during, you can see the thread, the body shaping changing. I use biostimulator in some cases, and I use a device, the name is cryofrequency, and this device is kind of a radio frequency sometimes. But if I use the device, I use before the threads, because you're not supposed to have heating over the threads. So if you do the treatment using the machine, if you use some device to improve your results, you should do the heating first, do the session using the heats, then you do the threads. So we're using one patient like that, like I'm gonna show you the amounts. We combine, you see the muscle? We combine the 30, 40 millimeters thread with the 30, 25 millimeters thread. In most cases, we use both. If I want to do biostimulator, I can do the same day as the thread, and there is no problem. Different than HA, the biostimulator doesn't degrade the threads, and the HA degrades the threads. So it's very important to know the difference between the two of them. If you use HA over the thread, HA is able to dissolve the thread. There are some publications showing that HA can dissolve the threads. So at the same moment, in the same region, you shouldn't use HA, but you can use biostimulator. We can use biostimulator. Yes, because we want to address the muscle. These threads, like that, they're touching the muscle. They're stimulating the muscle. And the threads that go more flat, they stimulate the dermis or the subcutaneous.
Is it okay to use before the first hyaluronic acid and after that threads? It's okay, or?
There is some publication, official publication, index publication, showing that when you have the threads, if you apply HA over the area, the HA brings water and gonna bring hydrolysis. It's gonna be bad for the threads. So we don't make combination in the same area, threads and HA, but we do often and regularly combination using the biostimulator like PLLA. We do lots of injections. Okay. So like this case here, you see like the elevation of the fold and the improvement of the shape. We work in this area here, the round area, all the threads like that, like in obliquous plane. And in the area of the lower buttock and going to the banana, we have the threads towards the skin and the fascia. So the same patient in profile, you can see even better result. So you can see roundness of the body. You can see improvement of the body. This case is just threads. There are cases I'm going to show to you that we mix thread and biostimulator. When the skin is more loosey, when you have looser skin, when the skin is more flexed, it's important to use the biostimulator. The threads only can be good, but not so good. But this girl, the skin tonus, the skin texture wasn't bad. So she just needed to improve the face. And even that I do the filler for the threads, there are some patients, they don't want to have fillers. And there are some countries, they don't allow fillers for buttock. So you can have in threads an option. It's very important to know that we use a different type, size of monothreads in this case. And we use like one box of each side. So we really make it full of threads, and the results are very pleasant. Because in Brazil, the girls, they hate when they have the flat in this area. They just hate. They really want to have shapy and round. And it's important when you're going to do your case, remember that implantation should address subdermis, subcutaneous, fascia, and muscle. It's very, very interesting. I'm going to show you a very nice, a very dramatic case of a buttock, okay? She want to have more round in here, so we did the filler, so it became round in here. But this flexidity before the threads, I didn't have the result. I only had the result in here, and here was still flexed. So here we use the threads, and when the skin is loose, like when you touch the area, the skin comes loose, we use the PLLA together, so we improve the result. So that's another case. And again, we did the implantation using subdermal level, subcutaneous level, fascia, and muscle. You have to be multiple, really multiple. And it's not painful at all inside the tissue because it's soft tissue, but the skin is painful. So that's why you need to do little points of anesthesia, or you can do numb cream if you have a good numb cream. Because especially when you use the screw type, we use the screw type 27G, and 27G needle is more strong, it's painful. And even the 30G needle is not so strong, but it's many, many, many times puncturing, so it can be not so comfortable for the patient.
And what is aftercare?
Sorry?
Aftercare.
Aftercare, very important question. We recommend the patient only for not doing exercises using this area for the first maybe 10 to maximum 2 weeks for not using this area as exercise. Can have normal life. Most of the case there is no bruising, and it's not painful at all. We don't recommend the user to take painkiller because they don't complain about pain. It's very, very interesting.
You mentioned 2 boxes. How many pieces?
6. The total here is it's 120 for each side. In here, look, in here, to come to this result, we had the filler, okay? But in here, to have this result, we use lots of threads in here. You see this rounded design here? We make like confluent threads. And then we apply like around 6 each side here, 6 each side here, and the other 6 we divide here and here. And they really, if you explain well, they really accept. especially the patient that doesn't want to have, like, they think it's to have foreign body in big amount for the buttocks. Some patient want, some patient doesn't want at all. So that's the amount that we use. We use a lot. So we can have great improvement. And in the past, we had this improvement here, and this area was just like the same way here. So it improved a lot, the results. And the last buttock case is just the thread, nothing more, no pillar lay, nothing, just the thread. And you see it gets shapy, it gets much better. Patient really, really love the result. Brazil, they do everything to have the round shape of the buttock. Yes? Okay, when you wanna go obliquous, like when you wanna apply here, mostly you wanna the 30-40 because you wanna make sure that the thread passes the subcutaneous and hits the muscle. But you don't want the thread just touch the muscle surface. You want the thread to go a little bit into the muscle. So you use the 30-40 here. When you apply the long lines in here, you can also use the 30-40. But when you do this little area here of the banana, or a little bit lower than the sulcus, you use mostly the little ones in here to reinforce like a I don't know, farra. Como se diz farra in inglês? It's like a band, okay? We draw like a band here.
And they're more shallow?
Sorry?
Are they more shallow in the banana roll?
Yeah, they're more shallow.
Subcutaneous?
Subcutaneous, subdermal. It's very important because there is one thing very important in my experience with threads, because they teach at the beginning to use the mono threads for the dermis. And the dermis sometimes is so thin. And if you use for the dermis like eye area, sometimes you can see the threads in transparency. And you should go a little bit deeper. And there are plenty of fibroblasts in the subcutaneous tissue. So you can go deeper, you can go to subdermal, you have a good plane to receive, you're gonna have the same collagen stimulation, and you don't see the threads. So this is we get the results as I showed to you. And then next, I'm gonna talk to you about the belly, about the abdominal, okay? So in Brazil, Botox is what they really wanna do mostly, is number one treatment we do, but we also need patients that wanna do the abdomen. You can do different kinds of abdomen. You are not saying that thread is gonna be substitution of a surgery, but many patients, they don't wanna go to the surgery, they can't go to the surgery. There is lots of issues related to surgery and post-operatory and scars and etc. So they wanna do improvement of the body. So you can have cases like this, like unfortunately the picture was taken already after being designed, but where you have a little bit amount of fat in here, and you have some flaccidity in there, we can use the threads. You can apply the threads. Remember that we want to address the subdermal layer, subcutaneous layer in the abdomen. And for abdomen as well as in the buttock, we want to use the monothreads, and the monothreads can be 30-40 and can be 30-25, the length. And we use also the screw type when we want to address the subcutaneous. Some people say that threads can make lipolysis. I myself, I don't think threads make any lipolysis of the fat, but I see in my practical day that threads makes a prison of the tissue that is loosey and then improves the shape. It kind of holds the subcutaneous tissue. So we use this for address this area. So then we make the marking of the patient, just make like the design where we have like the areas like deeper, where we have the areas that are like more fatty. And when you want to make skin quality, you have to be to the subdermal area. And if you want to do the fat, you want to make it more flat, you go to the subcutaneous, and then you really improve the shape of the patient. We do the same way. We're going to show you, like we do anesthesia, we do the asepsis very taken careful. And to do a belly like that, we use hundreds of threads. You don't use less than that. Otherwise, you don't have change, you don't have results, and we need results. There are many beautiful cases you can check on the web, some other professional, showing important flaccidity on the belly, showing even some area with some stretch marks that you can get nice improvement. You can get very nice improvement when you use the. So here the patient has already asepsy, and here we are just like applying the layer, like we are addressing the subcutaneous tissue. You have to be very precise. You have to be very precise to address the subcutaneous tissues. And then after we go from the bottom to the surface. So we address the subcutaneous tissue. We use a 20 ZG, 50 millimeters, it's a long thread. And then after that, you make layers more superficial to improve the skin. So it's very important now. I couldn't make it, so I got a forceps. And a little force can help you. If you have a longer thread, and when you are inserting, the thread cannot pass, it's very important to tip. You get a forceps, and then a forceps make it easier for you. So we have been doing passing a lot of threads on the belly, and it's 100% not painful. I didn't show in this video the anesthesia, but she had local anesthesia in all of them. This area usually has a fold, so it has can have a little bit of fibrosis of adherence, so sometimes it's difficult to the initial entrance. And we always do very stereo. We use the iodine, use the stereo champ. That's why we never had infection, and we never had problem using the threads. We have seen some problems from some colleagues. We have helped them. But in personal, we really didn't have problems. We just had nice results using threads. It's a very good experience that we have. And we use threads wherever you want to think that we can use. Any place in the body, we have used the threads. Not only the place that I'm presenting here, but other places.
Got experience about the efficacy that the other move tracks with the cooking?
Say again, please.
Have you experienced about the efficacy? It means long-lasting, comparing with the other tracks?
Yes, as I said to you, I have samples of threads that are expirated. And other brands I have with me, I have the pictures, they become like, they flake and they break. And the croquet thread, even if they are expired, they remained like rigid. So I really think that the quality is important. And that test that they showed to us, they presented to us, that put the threads in accelerated aging condition is like to pretend to make the thread become older, like 5 years older, showed the thread remained 75%. So I really found in croquis more stable and more lasting longer, the threads, I really found. This is because I'm not talking about barbed threads. There are the molded barbed threads. They have special molding, so they're even better for making lifting. Yeah, welcome. So we did the roll on the lower part. We are addressing here. We make crisscross, we cross. So when we do this, we cross, the subcutaneous tissue that is loose is kind of, we hold it, so it becomes more flat. So now it's like the time of the mono, the yellow ones, and then we apply the monos all over and then make it completely filled. Yes, yes, for sure. The other ones we made a little bit like this, address the fat, and this one we address the subdermal. And then we can have like improvement, like more flat and less bumpy in this case. And then we can even treat the challenge cases. We treated challenge case, but in challenge case, always you need to do some combinations. So this case here, it's a very severe liposuction result, very uneven. And we cannot use biosimulator here because there was some fibrosis. So we use the technique that I'm telling you that is the cryofrequency. We use the technique before. We cannot use the technique after placing the threads because the heating can destroy the threads. And we use the threads after we use the mono threads, and also we can use the screw threads. And we got in this case, in many cases of liposuction problem, liposuction like defect, we got results like this. It's really good, the result. Yeah, it's really good, the results. It's really good. It's really pleasant. It's really pleasant that you have such a technique that it's so easy. It's so easy to do. There is no point to be difficult. There is no point to have kind of a problem, to have like complication. If you just take the steps like being clean and taking care of being the right level, you just have good results. It's very important. So the last part, we are working for the arms. Arms are very difficult also. Like there's a big complaint, the area of the triceps makes the flaccidity, the skin sags in aging process, and also the skin sag when people lose weight. So this area becomes very flexible. And the relevant anatomy we are going to work is the number 3 here. And it's nice to be here because we have a big amount, a big layer of fatty tissue, and we are free of important blood vessels, and we are free of nerves, so it's safe to work around the area of the triceps. We also use for this the mono threads, can be 30-40 or 30-25 in our choice, and we use sometimes the screw type as well. And here's another little movie showing how we make this design. We make the area where it's deeper. We make the area where we have more like fat, if you wanted to compact the fat. And then we make the rest of the arm. And we make the design. Always like we use the colors to help us. The red is like to make the anatomical markings. And then like we pinch and we feel where we have more tissue, where we have more fat, where we have more skin losing. And then we mark the small threads in the small areas. And the bigger threads, we go deeper. As you're going to see, like we apply, not so shallow, so we address the muscle. And we can have really nice and beautiful results for the arms. And there isn't many options for the arms, for improving for the arms. So those points are going to address more deep. And the points over here, we are going to do the little ones more shallow. So it's always like a repetition, the techniques, dressing, cleaning, being very patient when we clean. And touching to know, where we're going to go, where we're going to dress. Also doing, I think I'm going to show here, also doing like the points of anesthesia. It's the design, it's the shape of your patient. It doesn't have a unique design. The design where you see the fatty bulging, where you see the skin sagging, you make design. It's a kind of individual design. So just doing the points of local anesthetic. Please, when you use an anesthetic solution, you can use a diluted anesthetic solution. I never, ever use the plain anesthetic because you don't need that. When it's diluted, it keeps the power of anesthesia, but you don't have any stress of having toxicity or using lots of anesthesia. So when I do the aesthetic procedure, most of the cases I do the dilution 1 to 10, and it works perfectly. It does work. It takes the pain, and you have 0 stress regarding to toxicity, and you're not using that much anesthesia. When I have a line like that, 2 lines, 1 line and 2 lines, I make the anesthesia in the middle. So one middle area, I can come from here to here, and I can come from here to here. So I optimize. I always try to optimize.
Do you have any study comparing this mono thread with suspension thread? I mean, for lifting purpose. So like this case, I think she needs lifting.
I have to explain to you my concept regarding to that. Like buttock, we sit down, we stand up. Okay? So when we do the barbed threads, when I do barbed thread for face, I anchor. I do anchorage. And I only believe in suspension if I have an anchor point. If you put the barbed thread over the subcutaneous tissue, the thread, even though it holds because it has the barbs, the thread is floating the tissue. So the person sit down and stand up. So in my opinion, in my experience, it doesn't remain as much result as if you put a lot of threads and you make a net inside the tissue. You
Yeah,
understand
but
me?
what I mean, you use this method, you use this monothread for volumize,
For?
for volumizing, right?
No,
To
also for
increase the
improve.
volumizing.
No, it's volumized.
Yes.
Depends if you go to the muscle, then it volumizes. But it improves the skin quality.
Yes, of course, because of collagenesis, right?
Collagenase, yes.
Yes, but for this case, I think she needs also lifting effect of the thread. So it needs lifting up by the.
You see the
bugs.
results. You see the results. I think we get
Yeah,
lifting.
my question is, do you have any study comparing
No, I
this?
don't have a stats comparison. I did few
I need
cases.
your answer. Thank you.
I did few cases. I didn't see impressive results, and I decided to be working in this way. But I don't have the comparison. Maybe if you have, and we can share, like exchange the opinions to see. But we get such a nice contraction of the skin that I think it's better to use the monothread for this. So we are applying like a little bit deeper between subcutaneous and muscle. So we're going to get the tonus of the arm, and the little ones, we're going to apply the shallow ones for the dermis.
How long is the duration? How long?
The what?
How long is the duration?
The result? If you do it proper like that, using the good amount of threads, and if you have like associated flucidity, then you can use the biostimulator. We've seen the result lasting at least good result for 1 year. 1 year. But you have to use, don't use like 10 threads each side because you're not seeing result. It really to be consistent.
How many
sure.
threads do we use in this case? How many threads?
In this case, we use it.
Yes.
30, 25, we use it 30.
Okay.
And 30, 40, we use 60.
And in the abdomen,
That abdomen was nearly 100. I don't remember if it was 120, 110, but I know it was nearly 100, for sure.
Thank you.
So we are making from low to top and from top to low. So you crisscross the whole tissue. I mean, if you know that PDO, like there is many publications showing that PDO makes collagen, builds collagen. So if PDO builds collagen, and if you make a net inside the skin, there is no way that you get improvement of the skin, that you get improvement of the texture, and that you get the nice results. It's very important because many, many, many people still are not using this type of technique. They're not currently doing this. And it's very useful. Like people want to have the arms fit, they want to have the buttock fit, want to have the abdomen fit. So it's a big potential for your clients, like to do, this type of thing. And very, very, very non-invasive. You see what I said for the anesthesia line? In one line, we do both sides. So it's very useful to, you gain like time and you pinch less the patient and you do pain-free in both sides. You can do this line. Usually to make the whole procedure, like making the design, no, this has been doing already. So I'm going to show you what we can get as a result. It's so beautiful that, nice that she has a navel here that you can see because some people can think it's a different person. So she got overall improvement of the skin quality. And I never seen before such improvement using threads. You can use the threads for fat. You can use the thread for muscle. You contract fat. If you use lots of thread in the fat, you contract the fat tissue as well. So you can have improvement. You can have improvement. So again, here, when you have bad case like this, I add the cryofrequency. If I have emptiness or holes, I do the biostimulator. So the conclusion is that you can really build a nice body shape. You can improve the body shape. You can improve the curve. You can improve the flaccidity if you use it threads. In my opinion, it's mono threads and screw threads. As I said to you, I use Croquis since the year 2020, and I really think it has given to me the best results. And if the case is really bad, you can improve the cases using radiofrequency, cryofrequency, or biostimulator as well.
May I ask, what about if you make combination after liposuctions for the abdomen and arm?
It's nice. Because when you do liposuction, sometimes you have some loose skin. Then it can, it can be very nice. We have some cases that we did correction after liposuction. Yes, yeah, with threads. So would you have some more questions? I'd love to discuss more with you.
When do you decide to use the twists versus the regular?
When do I decide what?
To use the twists, the cork.
Okay, mostly, you see, when you have like loose skin like that, okay, more superficial, I prefer to use lots of mono threads. I prefer to use the screw when I want to target a little bit deeper. I use a lot of the screw when I want a decontraction of the subcutaneous tissue or even the muscle. I don't like the screw in very superficial. Sometimes it appears.
So when the patient come to see you with the big hand and also with the skin excess, so your strategy is do the liposuction first and then do the thrust, or separately, or you can do it the same time.
If the person has
We want to have a
excess
small,
of the fat,
excess of the fat, excess of the skin. So what your policy?
like sometimes the person needs surgery, so I refer to a surgeon because I don't do the surgery. Like this lady, she had much more flaccidity and she had much more fat.
She have a surgery already.
She had surgery before, and she was worse than, I don't have the previous picture, she was worse than that. And after the surgery, she got improvement here, but she still had this flaccidity here. And then the patient doesn't want to go to surgery again. Many patients doesn't want to go to surgery. So we get the patient. When we see that there is the indication for surgery, we tell them to do the surgery first.
It means that you cannot do the liposuction to make it smaller, and then the.
You can do, but do first the liposuction, do the surgical first,
Yeah.
and then after do the threads.
Not at it's the same time. It means that you need to wait at least 3 months or 6 months later.
Yes,
and then
better wait, yes, yes. Okay. But if you start applying the threads on this area, and if you add, in the case where more necessary, the biostimulator, you're going to be surprised in seeing the results.
I think that I agree, totally agree with you, because in this case, for example, if we want to have the good result, you need, when we do the surgery, we need to have a vertical scar.
Yeah.
And it looks very ugly because it can be high on the armpits.
I know.
But by doing this way, you have a soft scar, and then you combine with the thread, and at the end of the day, you have a very, very good result.
Which is good because it's very easy to use. It's not complicated at all. The next one. This, when we have excess of fat and when we have lots of skin laxity, like the case that I showed in the abdomen, when we have lots of irregularity, to make together with a very good radio frequency like this one that we have, it improves a lot. But never I do the threads and then the machine, because the heating can be bad for the threads. So we do the heating treatment first and then the threads. And always non-invasive model. We don't like invasive, we don't like patient to be paying for nothing. Just like easy life for the doctor, easy life for the patient, and happy patients.
And you said that it lasts for the result lasts for 1 year.
1 year. If you do it properly, yes, at least 1 year, yes.
So It means that
If you
they
do
need,
it the way I'm showing here, yes.
yes, and
it's
then
safe.
they need to come back to see you after every 12 months. Come back to see and to.
Usually they come in the immediate post, then I kind of see them 2 or 3 months, and then they just appear like later if they want to do again.
With the next year they come back for, because if the result lasting for 1 year only.
Many of them, they come back and they want to do more after 1 year.
Yeah, so the number of patients to come back is a 50% or 90% of people come back normally.
I would say more than 50. I would say more than 50.
Yeah, so they're happy with the result.
They're happy with the result, yes. And what I tell you, it's very important, there is no complication. If you do these steps I showed to you, just find happiness for you, for your patient, for your practice. Is there any more question?
But for the touch-up, right? So when after 1 year, the patient will come back,
Yeah.
you do the touch-up, so the number of cracks is the same, or just like you see less than?
If the person has aging person, has a lot of flaccidity, she has already improvement behind. Even that she needs more, she doesn't usually necessarily needs the total amount 100%. It's always a little bit less.
Okay, so it means another, when for the touch-up phase, the number of cracks will be less.
Can be less, for sure.
50% or 20% or 30%?
Less, maybe 30% less, from 30 to 50, for sure. Yes.
It's great.
We
Thank
use
you.
more. It's so nice. When you do properly, either the threads or the threads and the biostimulator, when you do properly, like not making, like saving, like when you do it like I do a lot, there is a remaining result that seems that it doesn't disappear. So always you get advantage of this, and the next time when you do the touch-up, you need less.
And how much do you charge in Brazil? For area?
Good question. It's very common in Brazil to charge either 2 times the price of each thread or 4 times the price of each thread. It depends on where your practice is, like the power of the patients. When you have the power patients, it's 4 times the price of the threads. And if you have in the practice where people are not so much money, so you make 2 times. So from 2 to 4 times the price of each thread, you multiply. And I tell you very honest, when you explain to them the type of result you can give, and when you show them it's non-invasive and adventure, etc., most of them, like, the acceptance is really high. They really like. And the thing is that many patients doesn't still know that we can do this for body, and many doctors doesn't do it a lot in the practice. So it's very important to add these techniques.
If you need to do the surgery.
Should be less than the surgery, but it depends also on how in each area, like how the surgery charge. Like I know in the United States, for instance, it's very expensive surgery. In Brazil, you can have medium price and very expensive price. So it should be less than the surgery, yes.